So today, the topic of our lecture is gout. It's a common disease, and many people sometimes in our family also suffer at some stage of the life, and it's a very painful situation, especially in the big toe of the foot. Okay. What is that? Means what is the problem what is the pathophysiology of the gout? So, we will discuss these things in this lecture. Have you done the uric means purine metabolism? Hopefully, you have done in biochemistry purine metabolism. Okay. So, what is gout? Uh, Gout and pseudo gout. So, by definition, it is gouty arthritis. Okay. So, arthritis means itis. The word itis means there's inflammation. Okay, so in the first semester you have done this. That itis is usually comes when there's inflammation. Arth means joints. Okay, so inflammation of the joint. So inflammation of the joint and periarticular tissues due to deposition of monosodium urate crystals. As we have done in the first semester, inflammation. What is the definition of inflammation? How will you define inflammation? How will you define or you describe inflammation? Okay, so these are the signs: fever, pain, swelling. These are signs of inflammation. Means they appear after inflammation. But how will you define inflammation? What is inflammation? Because if you are studying pathology, inflammation you should be on your fingertips. Okay, uh, okay, good. Okay, so very good answers. So the most relevant will be the response of the body to some irritant. Okay, so very good. So what does it mean? There's some irritation, some problem, some foreign agent, something abnormal is there, and our body has a response. So majority of pathology goes around this. Some problem occurs and there's response of the body. So here also response of the body to what is the problem? There urate crystals are there. So few crystals are formed and they are abnormal. In a normal person, they are not formed. So these abnormal crystals are formed, and because of these abnormal crystals, there is inflammation, mean response of the body to fight with these crystals or to normalize the situation. So as a result, what happens? The same pain, all the signs of the inflammation, pain, redness, swelling. So these are the signs of inflammation. Okay, so all of these start to occur. A person feel pain, redness, difficulty in movement of the joint. So all of these are signs of inflammation. But what is going inside the joint? Inside the joint, actually these crystals are formed. And when these crystals are formed, so what happens? Now you can recall your inflammation that neutrophils will come, neutrophil will start to fight with the crystals, want to remove the crystals, and then all the signs will appear: the redness, hotness, swelling. So, so two words you should know. This is the inflammation, number one, and inflammation due to urate crystals. So these crystals are formed, which leads to inflammation. And when inflammation is there, all the signs of inflammation will be there: the redness, hotness, swelling, pain, etc. Okay, so these crystals are needle shaped, negative birefringent crystals. So these are needle shaped crystals, just like a needle, if you see. And under some light, they appear birefringent. Okay, so don't get worried about this word, but these glow in the under the light. Uh, so you can in the lab they can see and they can label, okay, these are urate crystals. So pseudo gouty arthritis. So pseudo, what is the meaning of pseudo? Very good. So fake, false, not true, very good. All are correct. So means they seem like gout, means same problem, but these are not actually due to urate crystals. Rather, they are due to calcium pyrophosphate crystal. And these are different kind of short, rhomboid, okay, like a means right like a square or something like that. So anyway, so gout is due to urate crystals, pseudo gout is due to calcium pyrophosphate crystals. So okay, so gout usually occurs in the middle age. So 40 to 60 is called middle age. Okay, so in this middle age, usually gout appears. And what is the cause of gout? So the main causes are abnormal purine metabolism. So purine uh, is metabolized in a normal person, but if some abnormality occurs, so ultimately they will lead to uric acid and then urate crystals. Okay. Yes. So synthesis of uric acid increases. Or the second abnormality can be intake is increased. The more intake of purine is there. So both will produce excess uric acid, which is called hyperuricemia. So hyper means more. We will see Umar in the next slide. So hyper means more. Uri means uric acid. Uric emia. Emia means blood. Okay, more uric acid in blood. So which will lead to more crystals. Yes. So pseudo gout. Okay, so gout is middle-aged disease. The main causes are abnormal metabolism of purine or more intake of purine, which leads to more uric acid. And the pseudo gout, which is due to calcium pyrophosphate crystals, it can occur in any age. Okay. Sometimes coexist with gout, means gout is also there, and sometimes this is also there. And the causes can be of pseudo gout is dehydration or it can be genetic. Okay, the dehydration usually in middle age and genetically inherited people are less than 35 years. So anyway, our topic is mainly gout, but that you should also know what is pseudo gout, the abnormal gout or false gout. That is due to calcium pyrophosphate crystals, and the causes are usually dehydration or genetics. Okay, so we will now focus on gout only. So purine metabolism abnormality or more intake of purine, and other causes also we will see in next slides. Till now it's clear. Means simple. It's gout is inflammation of joints mainly due to more uric acid or urate crystals. Simple. Till now it's clear. Okay, so inshallah it will be easy lecture. Okay, now we are focusing on gout. Okay, so we divide the gout into primary and secondary. So as the word is saying primary, primary means actually the problem is uh, with the purine metabolism. Okay, secondary. Sorry for interruption. There was some connectivity issue. Anyway, now you can listen me. Okay. So primary gout and secondary gout. So primary purine metabolism mainly affected. Secondary is increased nucleic acid turnover. So more production is there of purine, but due to some other disease. Okay, some other disease. Increased nucleic acid because purine is produced from the nucleic acid. So more turnover of nucleic acid, turnover means more production, more breakdown. So this is, if it is increased, it can also lead to more production of uric acid. So examples are leukemias. So in next, I think hematology module, you will do that, leukemias. So these are blood cancers, the cancer of uh, WBCs. Okay. So when the cancer of WBCs, obviously, uh, cancer means overproduction. Okay, so more cells are produced, more breakdown. So whenever there increased turnover of nucleic acid, the uric acid will be increased. Okay, inborn error of metabolism can lead to more uric acid, renal disease. So in this case, there will be means uh, it is not excreted. Whatever uric acid is formed, it is not excreted. So anyway, we will start from here. So enzyme defects. So primary gout means these are the enzyme defects. Means the for the metabolism of the purine, few enzymes are required. So you have discussed those in the biochemistry. So if there's some defect of those enzymes, okay, so that leads to primary gout. So most of the time enzyme defects are not clear. That what is the enzyme defects? So what, anyway, it will lead to overproduction of uric acid, and it can be with normal excretion or increased excretion. Okay, it can be due to normal excretion, increased excretion, or under excretion. Anything can be there. Means excretion can also be affected, but the main problem is overproduction of uric acid. Excretion from the kidney or from the mainly from the kidney can be affected. It can be normal, it can be increased, and can be less. Okay, and sometimes it can be less excretion with normal production also. So any of them can be there, but important thing you should know that enzyme defect is there, and most of the time it's overproduction of uric acid. So keep it simple. Okay, keep it simple. Overproduction due to enzyme defects. Unknown, or sometimes it is known what is the enzyme defect. So anyway, it will lead to overproduction of uric acid. So more uric acid will be produced uh, due to enzyme defects. And secondary gout, we have already discussed that the other diseases of the kidney, of the blood cancers, they lead to overproduction of uric acid, and mostly with increased excretion, because more production, if kidney is normal, it will excrete more. But sometimes reduced excretion can also be there with normal production, or overproduction with increased excretion. So if we make it simple, it is overproduction of uric acid. If kidney is working normal, so it will be excreted also more in the urine. But you should keep in mind it is overproduction of uric acid. So regarding the type, I will brief, just note it down. It is primary and secondary. Okay, remember this. Mostly it's primary, 90%, and few of the time it's secondary. And when we think primary, enzyme defects will be not known most of the time, or it will be known. And make it simple, it is overproduction of uric acid. Okay, so these things are less important. No more normal excretion, increased excretion, under excretion. These are less important things. Actual thing you should know is overproduction of uric acid. And when we are saying secondary gout, it's 10% of the times. So there's some other disease like leukemia, chronic renal disease, and it is also overproduction of uric acid. So keep it simple. Irritocate types means very easy primary or secondary. Primary, enzyme defect, okay, and overproduction of uric acid. Secondary, it's some other disease like leukemia, renal disease, and it will it be overproduction mostly, but in renal disease it can be under secretion. Okay, means excretion. It cannot be excreted well. Is it okay? Any difficulty, anything? I can repeat also, but keep it simple. It's very simple disease. Gout is very simple. Gout is overproduction of uric acid, which leads to your urate crystals, which leads to inflammation. Simple. Okay. And then the signs of inflammation. So already we have covered this. So high purine diet, one of the causes high purine diet. Person is eating more purine. Okay, red meats, fish. Person eating a lot of them. So it will lead to purine nucleotides and bases. Okay, so more purines are coming in the diet, or obesity can also leads to tissue nucleotide synthesis and metabolism. So it is increased in the obesity. Anyway, so if more purines are there, okay, so more metabolism is there, so it will lead to uric acid pool. Uric acid will increase. When uric acid increases, so normally it is excreted from the kidney and 30% from the gut. But if there is some disease of the kidney, renal impairment, or some genetic factors is there, any drugs will reduce the renal function, so it will also increase the uh, means this uric acid in the blood and ultimately urate. So keep it simple. More purine is coming, more uric acid. If kidney disease, excretion will be affected. In this slide, it is shown till this point. Now coming to what is going on in the joint. Hyperuricemia. It can be primary, it can be secondary. Means primary cause we have discussed, enzyme defect. Secondary causes can be kidney disease, can be leukemia, whatever. Okay. So more uric acid is produced. So what is going on in the joint? This uric acid will precipitate in the joint, just like anything. For example, if you have water, you put salt in it, okay, it will dissolve. But if you put lot of salt in it, it will settle down. Are you getting my point? So similarly here, if lot of uric acid is there, it will settle down and it will make the crystals. Okay. So crystals are formed in the joint. These crystals, because lot of uric acid is there, so ultimately it will form the crystals. So these crystals are not normal in the joint. So it will lead to complement activation. Okay, the complements will be activated. These are proteins which will be activated, and all means inflammation will start. Neutrophil chemotaxis. What does it mean? Neutrophil will come there. So as you know from the previous knowledge of inflammation, whenever there is some injury, neutrophils come, okay, as a response. So neutrophil will come and neutrophil will try to phagocytose the crystals. They will try to eat the crystals. Okay. So few neutrophil will lyse, break down, and lysosomal enzymes will be released. So all of these events will lead to the signs of inflammation. Okay. Tissue injury, inflammation, the swelling, the redness, the pain, loss of movement. So everything will occur due to inflammation. And on one side, neutrophils are coming. On the monocytes are coming. They are phagocytosing the crystals, and they will also release IL-1, TNF, IL-6. These are all inflammatory markers. So, uh, They will release the proteases. So anything lysosomal enzymes or proteases, they will damage the tissue. Okay, they will damage the tissue, and damage the tissue. The signs of inflammation will start to come. So anyway, this is all inflammation. You have already studied in previous module. So there's nothing new. Main thing, if you can remember, inflammation is there. So what is an inflammation? Crystals are formed, neutrophils will come or monocytes will come, and when they will come, they will phagocytose, and then they will release the enzymes or proteases, and injury of the tissue will occur. When injury occurs, pain starts to appear, swelling starts to appear, redness starts to appear, and this is called gouty arthritis. Means this joint in which this all of this is going on, we will say that gouty. This joint has gouty arthritis. Are you getting my point? I will repeat. Okay, just be with me. I will repeat the important points what we covered till now. Gout is inflammation of the joint, okay, due to urate crystals. Okay, so remember these words: inflammation due to urate crystals. From where urate is coming? Urate is coming because there is more purine. From where purine is coming? There can be two main mechanism. A person is eating lot of purine, meat, fish, like these things, or there is enzyme defect, primary and secondary. Okay, primary enzyme defect. That person is eating all right, but there's enzyme defect in that person. So what will happen? More uric acid will be formed, or some other disease can be there, kidney disease or leukemia. So that uric acid is not excreted or produced more. Anyway, there's more uric acid. So uric acid will change into urate crystals. Okay, hyperuricemia will change into urate crystals. When urate crystals start to deposit in the joint, so neutrophils will come, or and monocytes will come. So they will try to eat the crystals. When they will try to eat, lysosomal enzymes will be released or proteases will be released, and they will lead to tissue injury and inflammation, and all signs of inflammation like pain, redness, swelling, loss of movement of the joint, they will start to appear. So these are the important points you should keep in mind. Okay. So now if you have the concept of the gout, so now you can easily think about the clinical features. What will happen to that person? They can be asymptomatic hyperuricemia. That uric acid has started to increase. Hyperuricemia means more uric acid in blood. But there's no symptoms because still inflammation has not come to that level that symptoms start to appear. Okay. So it's asymptomatic, no symptom, no pain, no swelling, nothing. Just but uric acid is going high in the blood. Then acute gouty arthritis, then intercritical gout, and then chronic tophaceous gout. So we'll see. Asymptomatic, told you that nothing is there, means only uric acid is going high, maybe due to enzyme defect or something like that. Okay, the main problematic phase is acute gouty arthritis. So acute means suddenly pain starts. Okay. When acute inflammation starts, the time duration is very sudden. Within one day or few hours, person starts to feel a lot of pain. Okay. Acute. So sudden onset of joint pain, localized erythema, redness, warmth. So these are signs of inflammation. Okay. So mild fever can be there, but usually this joint pain is typical. And majority of first attacks are monoarticular, means only one joint is affected, usually. And 50% of time it's first metatarsophalangeal joint, great toe. Means your thumb of your great toe, sorry, your thumb of your foot, the great toe, that is affected. Severe pain starts there, metatarsophalangeal joint, okay, and less common in the ankle, heel, or wrist. So sometimes it is in the ankle joint, sometimes it's heel of the foot, or sometimes it's wrist of the hand, okay, of upper arm. So these are the sites. Majority of time it's uh, first metatarsophalangeal joint in the big toe. Okay, the typical. If in the question in anywhere in your exam in future it is written that in the big toe of the foot this pain started, so just think of gout. Okay, this is so typical most of the time. Okay, it can last for hours to weeks, and generally it gradually resolves and the patient enters asymptomatic intercritical period. So pains come, it takes few days, few weeks, and body recovers. Okay, body succeeds, so pain goes away. But it is intercritical, means pain can come again. It's in between period. If you will not treat, it is in between period. Pain will come back. So, in the absence of therapy, it can become polyarticular, means many joints can be involved. If you will not treat this patient, so many joints will be involved. And after a decade or many years, gradually, in between the attacks also, person still feels the pain. And then disease progresses to chronic tophaceous gout. Okay. So what is that? As the name is saying chronic, it becomes long duration. Tophaceous, what is tophaceous? That crystals are too many that they start to deposit under the skin. Please with me, okay? Be with me. The crystal starts to deposit under the skin, okay? In the joints also and under skin if you will not treat the patient, okay? So this can all, we will see in the next slide, inshallah. Or I should show you now. Look at this, okay? These are under the skin. So the crystal starts to deposit under the skin, in the earlobe, in the big toe. So if you will not treat, so this is called tophi, okay? The tophi, the crystal starts to deposit. Tophi is the plural and tophus is the singular. So ultimately chronic tophaceous gout. And at this stage, radiographs will show the characteristics of this disease. Even bone erosion starts, means bone starts to get affected, and you can see under in the X-rays, radiographs. And ultimately, renal manifestations can also appear because these crystals will form the stones in the kidney. Okay, so this is called chronic gouty nephropathy. Chronic long duration, gouty means the reason is gout, and nephropathy means the damage to the kidney. Okay, so stones can form in the kidney. So this is the overview what happens in this disease. So I will repeat, just listen again. The first is asymptomatic, hyperuricemia but asymptomatic. Then acute gout, sudden pain starts and all signs of inflammation, swelling, redness, like this. And majority of time the first attack is one joint, but gradually it can, and the joint is big toe most of the times. But gradually it can involve other joints also. Then person becomes normal. This is in intercritical period. And if not treated over the years, it can change to chronic tophaceous gout. So crystals can deposit under the skin. And then radiographs can also show that, and ultimately venous stones can be formed, which is called chronic gouty nephropathy. Is it okay? Means the overview of the disease. Any questions, anything you want to ask? Okay. So with this, we are coming to the last part of today's lecture, and that is the pathology. And it's also very simple, inshallah. Uh, so the site, as we have discussed, common is metatarsophalangeal joint. Okay. This is the most common joint which is affected. And, but other joints can also get involved of the wrist, of the hand, but most of the time it is this one, metatarsophalangeal joint. Yeah, in big toe mainly. So that's why I told in any exam in future means if it is written that pain started in the big toe, so just think about the gout most of the time. In your clinical practice also, if some middle-aged person comes to you and says that I have a pain in the big toe, so you can think about gout. Okay, do the uric acid test in the lab. Okay, so this is very typical indication of gout most of the time. Okay, so grossly means what you can see with your eyes. Okay, grossly. So swollen red joint with white chalky overlying skin. Okay, so swollen joint, but the skin is whitish in color. But the area of inflammation is reddish, and the urate crystals are there. Okay, so you can even the crystals can be around the joint also, under the skin. Okay, we will see in the next slide also. And there is damage to the tissue. So only thing grossly in the gross, what is the important point? I will tell you. The swollen red joint with white overlying skin, and and obviously we have discussed that urate crystals are there in the joint. Okay, coming to the light microscopy, what you see under the microscope. Okay, gross is with your eyes, but obviously you cannot see the crystal with your eyes. You can only see the swelling joint. You can see the red joint. But what you can see under the microscope is tophi granulomatous formation. Now, if you know these terms from your previous knowledge, it's very easy. Tophi means those crystals. Okay, the deposition of these crystals. These are tophi. Okay, this is under the skin. Okay, cross picture of tophi. So under the skin, and this is microscopic picture. These crystals get together. So what is granulomatous? Any idea what is granulomatous? What granule? What comes to your mind? Granulomatous, granuloma. Very good. Okay, so usually it's chronic. Very good. So as we discussed, that chronic inflammation can occur if not treated, and these crystals deposit under the skin also. So granuloma is formed. What is granuloma? So this is a description. Uric acid crystals surrounded by inflammatory cells, lymphocytes, giant cells. So all means this area with crystals and surrounding lymphocytes. So this is chronic form. In acute form, neutrophils come. So as we discussed in the acute gouty arthritis, that acutely very severe pain due to neutrophils. But in chronic cases, you can see a surrounded structure, lymphocytes in center, there are crystals are there. Okay. So ultimately fibers will form. So in all pathology it occurs. First acute inflammation occurs, then chronic inflammation occurs, and ultimately fibrosis occurs. So nothing new. So if you make a concept of pathology, it becomes easy. So in a normal means in a routine circumstances, this occurs. Acute inflammation, So you should know what is acute inflammation. Neutrophil will come, will fight, and the signs of acute inflammation will come: swelling, redness, hotness, pain. Okay. If not treated, it will become chronic. So when it will become chronic, so uh, lymphocytes will surround it, and ultimately fibrosis. So this is routine pathology. Okay, your question is for yes, FB is foreign body giant cells. So means many macrophages when come together, they can form giant cells also. Okay, as it occurs usually in granuloma. So giant cells can be formed if many macrophages come together and join together. So any question for pathology? So simple, important point I will tell you again. Uh, grossly, most of the time it's big toe. Okay, grossly redness. Uh, under the microscope, the crystals. This is called tophi. So whenever tophus or tophi come, it means crystals, jurate crystals. It can be under the skin, or it can, if in under the microscope, it will be like a granuloma. What is that? Crystals surrounded by lymphocytes and giant cells. Okay, so this is granuloma, and ultimately fibrosis can occur. Any difficulty in pathology? It's simple chronic inflammation. Only word, new word may be tophus. So tophi means these jurate crystals deposition. Any difficulty in pathology? Disfigure. Okay, I will come to this. I'm just asking about any difficulty in pathology. I will come to complication. Okay, so last part is this complication. Okay, so complication is very simple. The joint will become stiff. Disfigurement means abnormal shape. Okay, figure means the shape, and dis means abnormal. So abnormal shape. So joint become abnormal shape. Obviously, if you will not treat and inflammation will go on, the joint shape will be become abnormal. So this is called disfigurement. Okay, abnormal shape. And as we discussed, urate crystal deposition in kidney, renal stones. So this is one of the important complications. So Dada, you said, sorry, Dana, sorry. So you just asked about the complications. So one of the important complication of this disease is renal stones. Okay, so this is one of the important complications. So that's all for the lecture. Any question? I will repeat the important points of the lecture as I always do in my lecture. So just listen for 1-2 minutes. Be focused. Okay. What is gout? Gout is inflammation of the joint due to urate crystals. Okay. Now, from where these urate crystals are coming, they can be primary causes or primary type or secondary type. Primary type means enzyme defect. Okay. And secondary means some other disease. Other disease can be leukemia or some anything which produce more cells, cancers, or it can be kidney problem. Whatever. There's some problem is there, other disease is there. All leads to more production of uric acid. Or the other important cause can be uh, person is eating lot of purine in diet. So more eating or something going on in the body. Anyway, the uric acid becomes more. When uric acid becomes more, so they will start to deposit as urate crystals in joints. When they will start to deposit as urate crystals in the joints, neutrophil will come there, uh, monocytes will come there. They will try to manage the situation. They will try to eat the crystals, but what will happen? ultimately inflammation. They will release the cytokines and other things, and inflammation will start. And this is called acute gouty arthritis. Okay, severe pain starts. This pain can settle down for few weeks or few months, whatever the in between period, but it can come again. When it comes again and it will not be treated, ultimately tophus will start to deposit under the skin. Okay, and the complication, important one, is renal stones can start to appear. Okay, coming to the pathology, so very simple: gross redness of the joint, overlying white skin, light microscopy, tophi are there, tophus or tophi. These are urate crystals, deposition, and granuloma can form. What is that? That it is surrounded by lymphocytes, uh, and giant cells are there, and ultimately fibers will be formed. And that last, the complication, I will repeat that one of the important one is stone formation, kidney stone formation. So that is the summary of today's lecture. So anything you want to ask, or you want to comment or anything, please, you're welcome. Yes, there will be scenarios. As far as I know, they will be scenario based. Okay. Okay, best of luck